Good afternoon, everybody, and thank you for attending A Shot in the Arm, which is a COVID-19 vaccine webinar. My name is Jeff Donnell, and I'm president of Enterprise Health. And I'd like to welcome all of you to today's webinar, where we're going to talk about the role of technology in managing COVID-19 vaccinations. Today, we have a fantastic panel that I'm going to moderate. And our speakers include Dana Flitch, who is from Northwell Health, and she's the Senior Manager of Product Services and Management and Human Resource Technology. We also have Emily Mccomb, who's the Director of Customer Success at Enterprise Health, and also Alice Urich, who is a deployment consultant at Enterprise Health. Just to give you a little bit of context about our organization, starting with our elevator pitch, which of course we would only share in a well-ventilated elevator with 3 or fewer people all wearing masks. And here goes. We're the only cloud-based health IT solution that combines occupational health and compliance, clinical care, and employee engagement all on a single interoperable certified electronic health record platform. And our focus is on equipping our enterprise clients and their employees for a healthier future. And we work primarily with blue chip global corporations, government agencies, and hospitals and health systems. And our clients tend to operate their own on-site employee health clinics, and many of them also provide employer health services to other organizations. Now, before we get started, just a couple of housekeeping items. We've muted everybody except our moderators and panelists on entry so that we minimize background noise. And we are recording this session, so after today, we're going to email everybody with a link so you can access the recording. And I will let you know that most of our presenters are coming to you from their home offices. So we apologize in advance if there's any barking dogs or screaming children. It just goes with the territory today. And we're really excited because we've assembled a group of speakers who've really been on the front lines of preparing for the rollout of COVID-19 vaccinations. And we've asked each of our speakers to share some of their observations about today's topic, and then we're going to open it up for Q&A. And if you have questions, you can submit those via the chat feature in WebEx, and we're going to try to get to as many as we possibly can before we end the webinar. So, you know, there is no doubt that the entire world could really use a shot in the arm right now. And this COVID pandemic has been persistent, and it's really getting more and more difficult to keep count of wave after wave of positive cases, hospitalizations, and unfortunately, the death toll. COVID fatigue is very real, and our physical and mental health and well-being have been profoundly affected. And while the significant impact of this pandemic is now really seared into our collective conscience, one could easily argue that the individuals who are attending today's webinar have an acute level of awareness of the severity of this thing. And you are all the occupational and employee health professionals who have the responsibility within your organizations to keep your employees present, productive, and healthy. So whether you work in a corporate setting, at a government agency, or in a hospital or health system that's taking care of the people who take care of patients, you have both a personal and a professional stake as you respond to this once in 100 years event. Now at Enterprise Health, we've been collaborating closely with our client community to respond to this pandemic really since January or February. And fortunately, we started with an occupational health IT solution that already had the core building blocks in place. So we've been able to pretty rapidly reconfigure our pandemic response, employee engagement, case management, and reporting and other capabilities to support a wide variety of different client requirements and use cases. And that includes the management of employee symptom reporting, testing, travel, return to work, contact tracing, etc. And most recently, we've been able to take our existing mass immunization capability and make adjustments to it to support the administration of the COVID-19 vaccine. Now, we didn't do this in a vacuum. We've done it working very closely, yet still remotely, with our clients. And as we've done since really the beginning of this year, we've operated on a very agile footing as the ground is constantly shifting beneath our feet, and really never more so than with the COVID vaccine. And when it became apparent a little over a month ago that a vaccine was on the near-term horizon, we worked closely with a number of our clients to build out workflows based on what we knew recognizing, however, that we still lacked many critical pieces of information. So imagine, if you will, a mound of puzzle pieces with the instructions to start to assemble, but you know that 2/3 of the pieces aren't available to you yet, and you don't even have a picture on the puzzle box that depicts the finished product. So we've configured as we could. We made refinements along the way as more and more guidance emerged. And it's really just in the last week or so that we've been engaged in an all-out sprint as the final details have become apparent. So I have to take it just a second to recognize the really hard work of our clients and the enterprise health staff as people have managed to set aside their COVID fatigue. And working very collaboratively, these people have collapsed normal development cycles from months to weeks to days to even hours. We worked really hard over the last few weeks and even through this last weekend, and you can't help but be impressed by the efforts made to prepare for the administration of this vaccine. And as the holidays approach, I'm reminded of an episode from the TV show Seinfeld, and there's an episode where the characters celebrate a holiday which they call Festivus, which is a made-up holiday that features both the airing of grievances and feats of strength. And our collective community has been able to set aside their well-deserved COVID-fueled grievances, and what they've demonstrated is an awe-inspiring amount of feats of strength. And this is actually the 8th webinar we've conducted this year that's focused on COVID. And we've had several hundred people register for today's session. And frankly, we got lucky on the timing because we only decided about a week ago to try and pull this off. And because it's all come together in record time, it may not be our most polished webinar, but it will no doubt be the most topical and of the moment. And of course, as it turns out, the administration of vaccines in the United States started just yesterday morning. And the first individual in the US to receive the vaccine was a woman named Sandra Lindsay, and she's the Director of Critical Care Nursing at Long Island Jewish Medical Center in Queens, New York. And that's part of the Northwell health system. And in the last 24 hours, photos and footage of Miss Lindsay getting her shot in the arm have appeared in major newspapers, all over the national news, all over the internet. And Miss Lindsay actually led a team of hundreds of critical care nurses who've been caring for COVID-19 patients since the very first wave of this pandemic started. And as the New York Times reported yesterday, Ms. Lindsay volunteered to go first in an effort to appeal to men and women of color who are skeptical of vaccinations in general. So this picture of her receiving the very first vaccine is a very powerful symbol on multiple levels. So not only is the timing of this webinar fortuitous, but we're really lucky today to have Dana Flitch from Northwell Health here to talk to us. And as we contemplated trying to squeeze this webinar in before the holidays, one of our challenges was to find a client who could spare enough time to prepare and present. And I'm not sure how we did it, but we persuaded Dana to do so. And she did it with little notice and, of course, in the midst of frenzied preparations to begin vaccine administration yesterday. But she managed to find the time to manufacture the time. I know she worked on this over the weekend to be able to share her insights with us today. So the stars and planets kind of aligned for us, and today we get to hear from one of the individuals who's part of a big collaborative team at Northwell that paved the way for them to be able to administer the very first vaccine given in the US just a little over 24 hours ago. So with that, Dana, I'm going to turn it over to you, and I will bring up your slide deck here and advance them as you direct me.
Thank you very much for such a wonderful introduction. I'm very pleased to be here this afternoon to certainly share Northwell's experience and some of the bumps and bruises along the way. I think, Jeff, you summarized it up very well. There was a lot more questions than answers as this was going forward at lightning speed. So I'm very happy to present where we are now and how we got here, actually. So you can go to the next slide. So just a little bit of quick background on Northwell Health in case there's anybody who's actually not familiar with us, although after this morning, I can't imagine across the country anybody wouldn't be. We're the New York's largest private employer healthcare provider in our area. We consist of 23 hospitals, specialty hospitals, as well as psychiatry. We have a children's hospital. Our hospitals also go across counties as well as New York City. We have over 800 outpatient facilities. We service over 11 million people on a 13.5 billion annual operating budget. Our employees are 72,000 plus. We do have some other hospitals that have joined that are actually not in this count, always increasing our footprint and growing. We have over 6,000 independent credential providers that certainly use our facilities in the hospital, care for our patients, and well over 5,000 volunteers. So, and from this map, you can also see that we have affiliates in other countries. We're affiliated with the Cleveland Clinic in Ohio, and also well-renowned research facilities that we work with and, continuing advancing. Next slide. So the goal was basically in this lightning operation is for everyone to easily get vaccinated as soon as we have the quantities available. However, there wasn't really a lot of direction. I think many institutions were left up to their own devices to kind of figure out how to roll this out. We had more questions than answers, that's for sure. Next slide. So this was some of the things that we had to certainly sit back, reflect on, and act upon immediately, even as Jeff was saying, 3/4 of the information wasn't really out there. So some of the things that we had going on was when were we really going to get those vaccines in our hands, whether or not it was going to come from multiple manufacturers. Another issue was if it was single dose or multi-dose for tracking, which definitely introduced another complexity because we usually didn't have a single dose or multiple dose vaccine that I can think of at this point for like surveillance to be able to follow up on people to make sure they get their second dose, or were they fully immunized after the first dose. We also didn't know what volume we were getting for the distribution. So, being a large healthcare organization, that led us to have to start thinking immediately about how we're prioritizing our employees. And certainly any of our other affiliates, we have a lot of vendors that work for us, as well as we have joint ventures. All of these people needed to be put in some sort of priority on who's going to get that vaccine first, according to what was the actual volume that we were going to get. Again, all unknowns. Adverse reactions, even though the trials were advancing quickly, there seemed to be minimal adverse reactions, but, we certainly didn't know a lot of information on that from the studies yet, except that it was going at lightning speed and all seemed to be going well. We also don't know at the time what our vaccine demand was going to be. How many people were going to line up? Was it going to be a huge demand, or, certainly wanted that demand, but we really didn't know how that was what kind of reaction we were going to get back. And then, of course, to prepare communication, education, both to people who have to do the vaccinations, as well as those who are receiving the vaccinations, which leads us into the legality and consent. So there was really no standard for that either, except for other immunization consents. And we didn't know how this was going to be different. And then, of course, the big one for us is everybody is reporting to their state immunization registries. We also have a dual reporting obligation because we also have to report for our city hospitals directly to New York City as well. That also gave us another layer of complexity because vaccine distribution was hinging on us certainly being able to let them know what we're giving from two different sources. So both for our city sites as well as the state sites. So in all honesty, we had a lot more questions than answers during planning. So, but again, it was a go. And we had to certainly make a lot of decisions on the fly. Next slide. So I just want to bring everybody a little bit back on where we were at when we started this. So Enterprise Health was probably one of our fastest contracts ever done known to mankind, especially in our institution, because it usually takes a while to do the contracting. We love the product. So we had contracted very quickly over the summer, knowing that COVID resurgence was coming. Currently, right now, back in April, especially when this all hit New York, being the epicenter of this, of this disease and all that we had to do, especially on the back end, to support our frontline people with IT, tracking, tracing, testing. It was back in, I would say, probably really took off in April. We were doing studies on antibody testing, creating homegrown databases and surveys and things of that nature to be tracking this. So we were very excited to find the Enterprise Health product, the Channel 19. We immediately contracted for it. So there was a couple of things that needed to be done beforehand. We needed to address that we have the flu campaign, especially during COVID. We wanted to be able to offer those flu shots and stress the importance of, the health, the personal health of taking a flu shot. So we have a campaign that we offer flu vaccines to all of our workforce, employees and non-employees, that all needed to be tracked. In lightning speed, I would say probably in less than 4 weeks, we had that campaign up and running for our September launch, which is usually right after Labor Day. It was quite a feat. Couldn't have done it without the cooperation of Enterprise Health, who were so generous with their time, their expertise, integrations, all of it to help us get this launched. And then right after, as we were doing that, we also launched our system survey questionnaire for COVID-19 because it was a requirement. And the thought with this was we wanted to ensure employees are testing their well before they came to work. And we went live with that in October. And it's funny to say that it was a very much a success. We actually removed about 4 people from duty before they even got on site, just from the symptoms questionnaire. So again, that was 4 people that were not circulating in the hospital that possibly could have been carrying COVID and we needed to test. So again, another success given to the partnership between Northwell and Enterprise Health. So right after that, as that was happening, we got word that we're really getting close to Vaccination Launch. So again, speeding up into high gear because we needed to now plan for that as well. So luckily, we were able to model the flu module that we already had up and running for COVID vaccinations. Enterprise Health, again, was extremely helpful. There was a lot of things to work out, such as what questionnaires, what were the consents going to look like, communication emails. We wanted people to be able to get on our portal, do self-service scheduling to the sites that were giving out COVID vaccines. We needed a separate surveillance profile for single and multi-dose formats. And also we had to work on our population priority matrix for vaccines. And what we did with that is this was a real big team effort. We brought in on our side analytics committee to help us with that. And we had actually made a vaccine matrix for all the employees that were dependent on several factors. One was work county, where they worked, what type of department, what was their job function and role, and that as well as with their age. We then took all those factors and we weighted them. So we said if you were in a hot spot in a work county, that was worth 20% of your grade. If you were working in a department type like critical care, emergency, or ICU, that might have been worth 40% of your grade. And through that, we took our whole workforce and we created and assigned everybody a priority. So the priority was between 1 and 5, depending on vaccine release volume and how quickly we can push that out. So that was the way that we approached it for the actual priority to decide who was going to get that. And then we also needed to make sure that we had our feedback loop as far as the distribution. We had hooked in our system analytics team who's creating dashboards across the system on an hourly updates to make sure that we're constantly on top of what the vaccine distribution is, who's receiving the vaccine. And then the last part, of course, was to be able to report to New York State and the city. Again, great partnership with our vendor, because I don't think this could have ever happened without all the technical resources that have been put into it to ensure that we had the proper messages, the testing, getting the state and city on the line with us to do this type of testing and hook it up to the vaccine actual distribution. And then lastly, and this has only been within the last few days as we were getting ready to launch, getting emails ready, just scheduling, we also had to put together vaccine education, both for the people who are getting vaccinated as well as our vaccinators. We had to set up security profiles for that. And Enterprise Health, being a fully mobile software, is absolutely key to being able to just take this program anywhere and be able to vaccinate as our sites were popping up and are still popping up, frankly, today as we're adding sites and sending vaccinators out. So again, it couldn't have been done without the partnership of our software vendor. And I know it's been said as well from our leadership, if we were in the same position we were in April, where we were building homegrown databases to track all this, I don't think we could have ever gotten where we are at such light speed to see the result that you saw, that we were ready to go yesterday and start vaccinating. Okay, so I'll turn it back over to you, Jeff, but that was the Northwell experience on this. And as your sites are getting ready, I can't emphasize enough how having the right IT technology can spring you forward to get this done.
Great. Thank you very much, Dana. Really appreciate it. And you know, one of the things I'll just stress is that on the immunization registries, we literally were getting changes to the some of the registry protocols this weekend. So you know, this really did come down to the wire. You know, certainly not normal course of operations, but it is what it is. And as Dana said, you know, we're still making tweaks and adjustments even today. And in fact, right before we kicked off the webinar, I know Dana was kind of emailing furiously with some of her team members about some issues. So you know, I'm sure we will continue to refine over the next couple of weeks as this thing unfolds. Our next panelist is Emily Mccomb, and Emily is the Director of Customer Success at Enterprise Health. And she and her team have been working with a number of our existing clients over the last 45 days or so to prepare for the COVID vaccine. And so she's just going to share a few insights from that experience.
Great. Thank you, Jeff. Can you hear me okay?
Loud and clear. All
right. So our deployment and application support teams have been working with our customers for months in preparation of the vaccine rollout. We built the model using our existing flu module as the framework, and as more was uncovered about the vaccine, we tweaked and changed things to suit. And as you heard from Dana, even though our customers have been running employee vaccination programs for years for flu and hepatitis, the majority of the people we spoke with still have significant gaps to fill in for this vaccine specifically. And the first really being just identifying who to offer the vaccine to, especially for wave one. No one knew the number of vaccines that would be delivered. And that was a huge question that kept most of our customers from really understanding who they would offer this vaccine to in the first wave. So we spent a lot of time with these customers, making sure that we had rules built based on their job and department, but also just filled in the gaps with imports of spreadsheets for additional staff who, our customers knew needed to be a part of wave one, but maybe just didn't meet the criteria of those very specific rules. And I think now that we have a lot more information about supply, those rules will become a bit more scientific and predictable like they have been in years past for flu. And that will be, I think, a welcome change for many, many of our customers. Another hurdle that we had to clear was around the vaccine administration reporting. State to state, there is a lot of variability in immunization registry, say, maturity. You heard from Dana that Northwell had great collaboration with their state and their city, but unfortunately, that just was not everyone's experience. And some of our customers have had an existing immunization registry interface for years. And in those cases, they didn't have to give this topic much of a second thought, but others hadn't either pursued those integrations yet or their states had placed them on years-long waiting lists, and we were just not going to have that interface in place in time. So we've seen some really rapid and creative solutions around those issues. One of the things that we did with a few customers was to actually build an integration to their hospital. And the hospital then, in turn, passed along that immunization record to their state's registry through their existing feed to the registry. And this worked great for states whose registries couldn't accommodate a new interface very quickly, and it eliminated the need then for those customers to have to hand key those records in, which is a huge time saver. And if you are listening in today and you have not yet sorted out how you're going to report your vaccine administration, I would highly encourage you to make that a top priority in your planning, because it really can vary so widely state to state. And it is something we found, unfortunately, some states were just more capable of accepting kind of quick turnaround integrations than others. Additionally, when Warp Speed took off, we joked actually with Northwell that it would take them longer to get legal approval for their consent form than it would be for us to roll out the entire program. And unfortunately, for some of our customers, we were not wrong. We've been working with a lot of our customers right up until very literally the final hour to make changes to the consent form, which employees are filling out on the portal. Even as recently as late last night, we had team members working to adjust consent language so that one of our health systems out west could launch today. And that's just been the name of the game. It's been very difficult to get those approved and pushed through. And everything this year just seems to come down to the wire. We're really proud of how everyone has pulled together to make these rollouts happen, but we know this is just wave one, and we're gonna have to keep our head on a swivel as we move into the next phase of the COVID response. And also as availability of the vaccine becomes more widespread, we do anticipate that a lot of our critical infrastructure customers, like folks in energy, food supply, et cetera, they're going to have very specific needs around the vaccine that are going to be unique to either their industry, their region, or just their unique employee population. And we've scratched the surface with a lot of those folks to understand what their needs are, but we're really looking forward to digging deeper and learning more about what this will be like in a non-healthcare setting, because I think there are going to be kind of a whole new exciting set of challenges and configurations and integration projects around that. So thank you, Jeff, for giving me an opportunity to just catch everyone up on how far we've come and some of the variability that we've seen customer to customer, and I'll pass it back to you and Alice.
Okay, great. Thank you, Emily. So last but certainly not least is Alice Urich. And Alice is an enterprise health deployment specialist, and she works with clients to configure our solution to meet their workflow requirements. And Alice has really been the one working most closely with Northwell as they prepare for the COVID vaccine administration. So Alice is going to give you just a high-level overview of some of the functionality that we've been developing in collaboration with our clients.
Okay, thank you, Jeff.
Sure.
I think you'll have to give me presenting rights. It won't let me share.
Let me do that.
Okay, perfect. Just popped up. All right. Thank you. Can you see my screen then?
Yes.
Okay, perfect. Thank you. So today we're going to review the COVID-19 injection program. Again, this is just a high-level overview, and then we can take questions at the end. So Emily kind of touched on this a little earlier, and that was that we are using our health surveillance module to manage this program. And as far as enrolling employees into this program, we have two ways that you can do that. One would be by implicit rules based off of demographic data. And we do have some customers that are sending us that employee priority matrix that Dana spoke of through their HR demographic feed. And when we have that data available, we can set up automated membership rules so that you don't have to manually manage that. But we realize that isn't always possible if you're managing that outside of the application. And so we do have a method that you can manually add your members, as well as a import tool. So if you were to populate a spreadsheet using the import tool template, then you can import all of those employees into the program. Once the program and the employee has been added into the program, we have an automated process that will evaluate the panel membership. And when this happens, we have the panel configured to generate a questionnaire for the COVID injection, as well as an order for the injection. When we create the orders, we also create a waitlist appointment. And that waitlist appointment is actually what is responsible for generating an email to the employee to invite them to go to the portal and to schedule their COVID vaccination. We also have additional reminders that can be sent. Typically, a 3 or a 10-day and/or 10-day reminder can be sent. And then we also have the ability to send a post-injection educational follow-up email. So as the employees, with this being such a new injection, and again, I think we've talked about some of the allergic reactions some people have had to that we really want to make sure the employees have that education, that they know that if they have issues that they can call to the clinic and report those. So in addition to just giving them like a viz handout when they're given the shot, we're also sending them a post-injection educational email as well. Once the employee receives the invitation, they can log on to the employee portal, where they have an option to schedule a COVID vaccination appointment and to take the questionnaire. And we have done some additional configuration to our scheduling module, which would allow only those employees with a waitlist appointment to schedule. Being that demand is very limited right now, and we talked about that priority only being able to offer to a certain number of employees that you have shots available for, we needed a way to be able to open up the schedule to just those with the waitlist appointment that receive that invite, and not allow all other users within the organization to go and try to schedule their appointment. So we do have this additional configuration that can be completed with the scheduler to limit the scheduling of appointments to just those individuals that receive the invitation. The questionnaire is configured to have a consent. It can be a declination, as well as allow the employee to submit an exemption request or to upload proof of a vaccination completed elsewhere. And with many healthcare workers, it's not unusual for a staff to also work per diem at another location or have 2 part-time jobs. And it's possible for an employee to receive an injection at one facility, or maybe you transfer employers and you have started the series, but you need to get your second shot. So we do have the ability for the employees to be able to submit proof of a prior documentation over the portal. And again, we did kind of fashion this very similar to our flu program, where we have the consent, the declination, exemption. But with this being a new program and employers not really at a point where they can require employees to take the COVID vaccine like they would a flu, that we have had several of our customers actually remove the declination and exemption request options and really just leave this order for the questionnaire out there for employees and let them opt to complete it or not. Obviously, if they want to receive the vaccine, they would fill it out. If not, right now we are just leaving those out there. And that time that we leave those orders out there can be defined within the panel configuration. So if you want to leave it out there for a year for your employees to change their mind and receive it later, that can definitely stay out there. So again, how you want to attack this from your organization standpoint is configurable. But I think, again, most people are leaving it at the consent and the questionnaire and only requiring employees to fill it out if they choose to have the injection. When the employee completes their questionnaire and they schedule their appointment and arrive, then we have the COVID injection program side menu tab here. And this is where the clinical staff can come in and enter the patient injection. When you enter the patient name off to the side, we do have links to navigate to the patient chart if for any reason the clinician needs to review any other data. We list any meds, allergies, and conditions, and then we also show the questionnaire along with their responses. And then we also show a list of the injections at the bottom. And this is really important that the clinical staff have this visibility when they're administering so that they know if they're giving the first or second dose. Because if you've started the Pfizer shot, then you need to have Pfizer shot as your second shot. You can't mix manufacturers and have one dose from Pfizer and a second dose from Moderna. So it's important that the clinician is checking this information to ensure that they are properly administering the correct medication. If you do not have portal access, or if you choose to have your employees have that ability to complete consents or declinations once they arrive, you can configure the COVID consent in a chart tab where you can ask your questionnaires, and using a touch screen or a mouse or stylus that they can check off the questions, the responses, and then manually sign for it. So we do have that ability available with, being in these times with social distancing and using styluses or touch screens and not having many people wanting to do that. I think we're seeing fewer people move in that direction, and they want to have them do that all online, but we still do have this as an offering. For any of the, if you have the declination exempt request, or if you're allowing your employees to submit proof of the vaccination from outside of the organization, we do automatically task any of those requests to a department called the COVID-19 Vaccine Program Reviewers Department. And from there, the clinical staff can come in and grab these tasks, review them, and set a determination reason. And these determination reasons are typically that they've already had one, that the documentation that has been reviewed is not adequate, it's denied. They may submit multiple or duplicate documentation. So there's a little bit of flexibility here in configuration as to these determination reasons. And you can list whether the employee has completed the series or if they have just had the first shot only. And based on those reasons, we do have an automated process that will send a confirmation to the employee once the clinical staff has either accepted or denied the documentation. And we will send that confirmation letter that you see here. Here's the approved vaccination or approved documentation, and here is the denied. And if your organization allows employees to send in or drop by the clinic, which we all know that happens, that they bring in a paper consent or that paper documentation, you can fill out or rather obtain those paper documents from the employee and scan those into the system as well. Regardless of how your employees are filling out their surveys or signing their consent forms, we do have an automated process that will look at those, the data that you are entering into the system, and the automated job will go ahead and complete all of those orders for you. So you can see here on this example, the patient's information has all been obtained, and then these orders have been marked completed for you. And we want to make sure that those orders are being tracked appropriately so that we can run reports and see who has completed their vaccination and questionnaires and who has not. Once the employee has had their first injection, we do have the health surveillance panel configured to generate a second set of orders for the second injection and a second consent and questionnaire to be generated. So you can see here in our programming that 4 weeks after the Moderna injection, we will populate a second set of orders, or at 3 weeks, we will create a second set of orders for the Pfizer injection. And once we do that, you'll see here, just to show you on the do list what that looks like, that the employee has those orders, they're generated, and they generate new due dates for that employee to complete those. So essentially what happens at that point for the second injection, it is the exact same workflow that I just reviewed. So that waitlist appointment is going to display, the employee is sent that invite to schedule their second injection and to complete their questionnaire. Sorry, went a little too far there. So the next thing is reporting. From a reporting standpoint, we have essentially two reports, and the first is the COVID vaccine exemption request determination. So this is for any of those requests that have been received via the portal and reviewed by the clinical staff as to whether it was approved or not approved. And all of those determinations are here. So you can track any of those determinations that were submitted from outside the organization. As far as inside the organization here, we do have the standard out-of-the-box to-do list waiting report, where you can run a report of all of the COVID vaccine injections. And from that, you can actually pivot this or filter this information really to get different data. So you could sort and just see the number and the discrete listing of each employee that still has pending injections, meaning they have not chosen to get the injection, and those that have completed them. If you don't put a filter on, then you would obviously see a list of both completed and pending, so you know what the total offering was. So that is my high-level overview of the COVID injection program.
Great. Thank you very much, Alice. Appreciate it.
Mm-hmm.
All right, great. We told Alice, knowing that all of this functionality is literally coming together just in the last couple of days as we've been finalizing it. She felt it was safer to show screenshots today rather than go in and demo, just because we're still making a lot of tweaks and improvements on a regular basis. and again, want to thank all of our presenters for sharing with us today. And we now have some time set aside for Q&A. And remember, you can pose questions. There's a Q&A or chat feature in WebEx, and of course we'll get to as many as we can. And I'll go ahead and just kind of kick us off here, with a question, and then we'll go from there. And Dana, I want to start with you. The term warp speed has been used to describe, the operation that was used to develop and roll out the vaccine. And of course, we're seeing organizations move at an amazing clip to be able to administer starting yesterday. But I will say there's fast and there's Northwell fast. And I'd just like to hear a little more about the effort and maybe the part of the culture at Northwell that enabled you to be the first organization in the U.S. to vaccinate one of your employees.
Yeah, so it sounds a little cliche, but I have to say everybody has to be working in sync. You need everybody engaged, from senior leadership to your technology group, to your analytics group, to employee health services. Again, I can't tell you, your team was just amazing with the engagement, helping us along with all the technology pieces of it. I mean, especially with designing this all on the fly. But I have to say, you have to have engagement from all the way through to make this really happen. So it was not uncommon. You could be in the middle of one call and somebody's texting you, ringing you, chatting you, and you're just kind of almost schizophrenic to a point, but you're answering every question. Everybody was pretty much on call. And I think one of the most important things is when you needed to make a decision, the right people were at the table, even virtually, to make a decision right then and there to keep moving. So I think that had a lot to do with it. I think also the support of senior leadership. If there were any obstacles at that point, they were able to clear them for us. And that was also extremely important as well.
Great, thank you. Hey, Emily, I think you've got a couple of questions from the chat.
We sure do. A quick one for Dana. How many employees are there at Northwell?
So right now, it's funny because, any way you look, you'll see a different number. But currently, right now, on the Northwell system payroll, there's over 72,000. However, we do have a couple of acquisitions that'll be moving on to payroll next year. So the number's actually higher.
A couple. Quite a few.
Yeah, we just keep going and going. So yeah, but right now, definitely well over 70,000.
Great, thank you. And another one for you, Dana. As you feel comfortable answering, if you get the vaccine, can you still be an asymptomatic carrier and still should wear a face covering in public? That last piece was a question asking if once you're vaccinated, if you should still continue to wear a face covering in public, if you feel comfortable with any of that.
So the answer with that is, and I'm also a physician assistant, working closely with employee health services. So clinically right now, yes, you are to continue using your social distancing, mask, washing, sanitizer when needed. All precautions are still followed, even if you still get the vaccine. Although the vaccine is incredibly effective, until we get direction that the immunity is, long-term, and there are still things that are coming out about that. We know the vaccine right now is safe. There certainly were no shortcuts in releasing that vaccine. However, all the other precautions still remain.
Great.
And even when we had our press conference yesterday morning when we were vaccinating, that was also reminded. As we take right now, it is one step towards the light at the end of the tunnel. So until we have absolutely affirmative, then we continue doing everything we're doing today.
Great, thank you. Great question on the Q&A. Again, Dana, for you. Did Northwell send out any type of survey to get an idea of just interest from the staff on a rough estimate of how many people you thought might be early adopters of the vaccine?
I wish we had time to do that. Normally we would have. And we do that. We usually do pre and post surveys, trying to get engagement, opportunities for education. But I have to tell you, a lot of this moving at such a, speed of light here, there really wasn't a lot of time to do that. I will say, however, the actual, and like I brought up in the slide presentation, we really had no idea what the demand would be, but we are finding demand. And vaccination is going very smoothly. Our tier 1 people are going first, but there is a lot of interest in getting the vaccine throughout the health system. So unfortunately, we have to stick to our priority, but we are definitely seeing demand from our employees and non-employees as well. Like where they are on the wheel, they're all set to make that appointment and roll up their sleeve. So it is wonderful to see.
Yeah, absolutely. A question from the chat here. Is there a period of time post-injection of the vaccine that the patient must be observed for specific signs and symptoms? How have you guys done that, Dana? How have you structured kind of that post-vaccine overwatch?
And like I said, there really was no shortcuts in delivering this. It was just done extremely quickly. Side effects that are usually noticed or common side effects that can happen with any vaccine: fever, muscle ache, soreness at the site. Over in London, I think there were 2 people that did have an anaphylactic reaction. Both have pulled through. Again, that's par for the territory. There are some people that may be allergic to components of the vaccine. So far at Northwell, I have not had any word that we've had that issue, but there really honestly isn't any different from any other vaccine. So it is the same. I just want to check in that I answered the question if there was any other parts to that.
Well, and I was going to say too, I know I've seen a couple of reports that say, especially based on a couple of those cases reported in Britain, you probably ought to have a brief observation period of maybe up to 15 minutes just to make sure that the that the recipient is okay, and again that kind of thing is fairly standard as well.
And I was going to say the same thing. It's no different from any other vaccination procedure. So again, I would imagine, and this is just a clinical, but sometimes you have to be sensitized. I would imagine if there are allergic reactions or issues, you may actually see it on the second one for allergies versus the first one, but it remains to be seen.
Yep.
Yeah, thanks, Dana. Really interesting question in the chat. I wish that Dimitri and folks from your IT team were here to answer this, Dana. But
I'll give it my best shot.
No, I think this is a great question, and you kind of spoke to it when you talked about the leadership engagement. But the question is, how would you describe the roles of your IT department compared to the employee health department during the implementation and also for ongoing support? You have a very engaged IT team who really partnered with you. Can you speak to kind of the roles there?
Oh, absolutely. So my role is I support the business and technology from the business end. The role of Dimitri was that he supports healthcare applications infrastructure throughout all the healthcare applications. So EHS is a part of that. So it definitely needs high IT engagement. We also are able to, through Dimitri, if there are any holdups or issues, I mean, we can bring that directly to our, CIO. And that is very important to have should there be any, problems or concerns. And it can go anywhere from I am having different signing out of the software on an iPad for a vaccinator to we need to be able to hook up with this registry and we need a connection with senior leadership to pull some strings to get that testing done. So I can't emphasize the importance of having IT infrastructure involved. It could be even single sign-on into, you may need your network team, all of it. So very, very important and great question. And yes, they were incredibly engaged and part of the team.
Great, thank you.
Okay. And Dana, you alluded to this a little bit in one of your previous responses, but of course, we've seen a lot of media coverage about some of the potential risks, and people are understandably hesitant to be among the first to take the vaccine. I'm just kind of wondering, what's being done to address some of those employee concerns, and also to address the fact that, some employees are just going to elect not to get the vaccine. Have you guys started to kind of think through, how are you going to kind of handle the folks that maybe decide not to do that, and kind of what maybe describe some of the educational efforts you have underway?
And it's a great question. So right from the start, even during the press conference, multicultural, multi-ethnicity was addressed. So that is definitely, even from the ICU nurse, the very first person who was vaccinated was certainly self-attesting what's going on in her life and the dark history of that, as she said it, with her, both personally and professionally, that she had no hesitation. So right from the beginning, we're putting that message out. What I think most people did not see is that there are 5 doses in that vaccine vial, which aren't going to go to waste. So there were actually 5 people that got vaccinated across the cultural and ethnic backgrounds. But, she just happened to be on the forefront from the start to absolutely start addressing that. So that messaging will continue to go out. I think a lot of it is, as this time goes on, that people start being even more comfortable with it, because sometimes, you still have people who, won't take a flu vaccine because they still feel, I get the flu from the flu vaccine. So it's always a constant education effort. But I think truly, as people who are vaccinated and as the numbers start going up, and like I said, we are seeing demand, I think that'll also give reassurance to those people who are hesitant. And right now we have some time for that because priority 1 people are going first, depending on the matrix factors that I discussed. So there still is some time, but I think that's going to be a very main component, aside from the education that's constantly being driven out there to everybody, that this is a safe and effective vaccine.
Great. Well, and you can't underscore, I think, the importance, and I think what happened yesterday at Northwell just really emphasizes that if you can get key individuals within your organization to raise their hand and volunteer and say, I'll go first, so I think that's a critical message for leadership within any employer organization. Certainly the folks that are involved in occupational and employee health. But if you can get someone, at the executive team, and also identify those folks within your organization that are well respected and that people will tend to follow, that goes a long way. So because obviously there can only be one organization who was the very first one to get vaccinated and get all this coverage. So I'm sure that's going to help with Northwell's effort, but I think for everybody else, it's, there's a good lesson here in terms of making sure that you have senior leadership involved, engaged, but also, have some people in leadership who are willing to go first.
Absolutely. I would have liked to have seen our CEO, Michael Dowling, get his vaccine out of those first 5, but I think they chose healthcare workers.
Yeah, probably makes sense.
Although I have to tell you, he sent out a video to everybody, just, and he was very emotional about the whole thing. It was really nice to see. And like I said, all that engagement.
Yes, absolutely. Emily, I know, and you alluded to this in your comments, but I know many of our health system clients, have been sort of first in line to get their employees vaccinated and get this underway. But I know we've also started to have some interest from some of our corporate clients. What differences are you seeing between the two segments in terms of what they're wanting to accomplish with their vaccination programs?
Yeah, so there's certainly a lot of crossover, but when you look at, say a petroleum company, that spans multiple states all over the country, maybe all over the globe, you start to get into some level of complexity that a typical healthcare system doesn't, and that's, what we've implemented so far are, our healthcare partners. Most of our healthcare partners are very regionalized, so they really are encompassed all in one state typically, not always, but most of the time. And that's just not the case when you have, pipelines all over the country, again, maybe all over the globe. And so the vaccine reporting requirements actually become much more complex because you might have now, not only like Dana had, I think it was New York City and the state to report back to, but now that's going to be across multiple states. So that has been certainly early conversations that we've had of getting each of those states engaged to understand how we can work with them to get those vaccines reported. But also a lot of our non-healthcare customers, they actually provide clinical services to dependents as well. So now we are looking to incorporate, in later waves of the vaccine rollout, how we can assist with tracking dependents for their vaccines and their consent forms and getting them reminders to come back for their second vaccine and all of that. So I think the spread out nature kind of presents its own really unique challenges actually for our non-healthcare customers, where at healthcare it's typically, you have such a concentration of people under just several roofs. On the non-healthcare side, they tend to be spread out all over the place, and just making sure that we're really targeting critical people within those organizations with communications. That's been top of mind. And like I said, just getting the state requirements fulfilled for the reporting, I think is going to be the most unique challenge there. And it's something that we're, trying with most of those customers to get ahead of just as much as we can.
Okay, great. Thank you. And a question probably for Emily and Dana. I know that certainly most organizations already have forms and protocols for consent and declination that they use for things like mass flu campaigns. What are some of the changes that had to be made around that to administer COVID? And I know, Emily, you alluded to, clients that are like having legal review that lasted until, late last night on consent forms. What are some of the big, maybe legal policy, just operational differences that we're seeing between something like flu and COVID?
Yeah, from the Northwell perspective, I wasn't too involved on those legal planning, so I probably couldn't speak to it very intelligently. But I will say this, though, one of the big hurdles that we had to pass from the IT standpoint is that we must release these to the state and city to get replenished with that vaccinations. So we had to, and technically on the registries, you are able to opt out. So we did have to overcome that hurdle where we said, this is part of the consent. You are opting in, or you're going to need to get your vaccination elsewhere, because otherwise we couldn't get replenished. So I would say that was from the IT standpoint to make sure that everything was going to the registries correctly for replenishment. That was one hurdle we had to get past.
Okay.
I don't know if Emily has anything to add from other clients' perspectives with the consent.
Yeah, I mean, it really was just a matter of time, so much time involved in getting everything approved through legal. I think there were a lot of jitters about, what an appropriate consent form would contain. So there was just a lot of very last minute, changes and pulling of the form to say, no, we're going to redraft, we're going to rewrite. And, understandably so, there's a significant liability being undertaken there. So just the time. And I would, again, we encourage people to get their reporting requirements well understood and get that underway if you've not already started working, with your teams to get a consent form put together. I would strongly urge you to do that because it will take a good bit of time to get those turned around from legal.
Okay, great. We're nearing the end of our time, but I do want to add one final question kind of for anybody. And, of course, as we said at the very beginning, COVID fatigue is very real. I think we've all experienced that both professionally and personally. And we certainly know it's been a significant issue among healthcare workers, but it is fairly universal. And, as the promise of a vaccine is now becoming a reality, just wondering, like Dana within Northwell and maybe Emily and Alice across our client community, are you starting to see any shifts in mood or attitude? I know we're not out of the woods yet, but I'm wondering if maybe the arrival of the vaccine is at least maybe brightening the light at the end of the tunnel a bit, and just interested if you're seeing any attitude changes out there.
Yeah, hard to speak to it yet. I think our ICU nurse yesterday summed it up perfectly. This is the light at the end of the tunnel. We definitely need to start taking steps for that to achieve that type of herd immunity and to certainly, move forward and end this devastation with this disease. So right now, like I said, I think people are excited. And like I said, even our own CEO was pretty much moved to tears, and we had a little video clip of the vaccine being delivered, and it's a very exciting time. So I think anticipation, I think excitement, yeah, and just the fact that we're already taking steps to move forward to end this.
Great. Okay, well, unfortunately, we are, I think we're at the end of our time here. Great discussion. And I really want to thank all of our panelists, Dana and Emily and Alice. I know firsthand you're all incredibly busy. So I appreciate your willingness to prepare for today, to present, to answer questions, and to share your insights. It's extremely helpful. And I also want to thank everybody who attended today's webinar. We know you're all busy as well, and we appreciate all the work that you're doing to keep your employee population safe and healthy. And we certainly hope that with the advent of the vaccine that you are starting to see some of that proverbial light at the end of the tunnel. We will be sending out a link probably in the next day or so to everybody with a recording of today's webinar. So again, thank you all. Stay safe, stay healthy, and have a great holiday season.
Thank you, everyone.
Thank you.